What is an eating disorder? Eating disorders describe illness that are characterized by irregular eating habits and severe distress or concern about body weight or shape. Eating disturbance may include inadequate or excessive food intake, which can ultimately damage an individual's well-being. Types of disorder. The most common forms of eating disorders is anorexia nervosa, bulimia nervosa, and binge eating disorder. People with anorexia nervosa generally view themselves as overweight, even if they are dangerously underweight. They tend to constantly monitor their weight, avoid eating types of food, and severely restrict their calories. Common symptoms of anorexia is that they are being considerably underweight compared to people of similar age and height, a relentless pursuit of thinness and unwillingness to maintain a healthy weight. They have a very restricted eating patterns and also have fear of gaining weight. Anorexia can be very damaging to the body. Over time, individuals living with it may experience the thinning of their bones, infertility, brittle hairs and nails, and the growth of a layer of fine hair all over their body. People with anorexia nervosa may limit their food intake or compensate for it through various purging behaviors. They have an intense fear of gaining weight even when severely underweight. Bulimia nervosa is a repeated binge eating followed by behaviors that compensate for the overeating, such as forced vomiting, excessive exercise, or extreme use of laxative or diuretics. Bulimia can have injuring effects such as gastrointestinal problems, severe dehydration, and heart difficulties resulting from an electrolyte imbalance. Symptoms of bulimia: recurrent episodes of binge eating with a feeling of lack control, recurrent episodes of inappropriate purging behaviors to prevent weight gain, a self-esteem overly influenced by body shape and weight, and a fear of gaining weight. Side effects of bulimia may include an inflamed and sore throat, swollen salivary glands, worn tooth enamel, tooth decay, acid reflux, irritation of the gut, severe dehydration, and hormonal disturbances. Bulimia can also create an imbalance in body level of electrolytes such as sodium, potassium, and calcium. This can cause stroke or heart attack. People with bulimia nervosa uncontrollably consume large amounts of food in short periods of time, then purge. Binge eating disorder. People with binge eating disorder frequently lose control over his or her eating. They typically eat unusually large amounts of food in relatively short periods of time and usually feel a lack of control during binges. Common symptoms of binge eating disorder: eat large amounts of foods rapidly, in secret, and until uncomfortably full despite not feeling hungry. No use of purging behaviors such as calorie restriction, vomiting, excessive exercise, or laxative or diuretic use to compensate for the binging. Feelings of distress such as shame, disgust, or guilt when thinking about the binge eating behavior. Feeling a lack of control during episodes of binge eating. People with binge eating disorder are often overweight or obese. This may increase their risk of medical complications linked to excess weight such as heart disease, stroke, and type 2 diabetes. People with binge eating disorder regularly and uncontrollably consume large amounts of food in short periods of time. Unlike people with other eating disorders, they do not purge.